Signs of iron deficiency. Iron deficiency causes signs in two broad categories. General signs of anemia. It is common to any type of anemia, not specific to iron deficiency. And iron deficiency specific signs. These are findings that point specifically toward iron as the cause, not just anemia in general. Today we'll go through both, since knowing which signs are just anemia versus which are genuinely iron-specific is what separates a good clinical exam from a generic one. This framing matters clinically because a patient can be iron deficient without being anemic yet. Iron stores can be depleted, showing low ferritin, while hemoglobin is still technically normal. And some of the iron-specific signs, like pagophagia, ice craving, can actually appear at this pre-anemic stage, before hemoglobin drops. First, we will see the general signs of anemia. These are non-specific signs. Fatigue, weakness, shortness of breath on exertion, dyspnea, palpitations, dizziness and lightheadedness, headache, pale skin and pale conjunctiva, pallor, and tachycardia, fast heart rate. These findings simply reflect reduced oxygen carrying capacity and the body's compensatory response. They're identical whether the anemia is from iron deficiency, B12 or folate deficiency, chronic disease, or anything else. None of these alone should make you jump to iron deficiency specifically. Now we will discuss the signs specific to iron deficiency. This is the important part. Koilonychia. The spoon-shaped nails, where the nail surface becomes concave instead of the normal convex curve. Platynychia. These are flattened nails, considered an earlier stage before full koilonychia develops. Glossitis. It is smooth, red, swollen, sometimes painful tongue, from loss of the normal tongue papillae. Angular cheilitis, also known as angular stomatitis. These are cracks and soreness at the corners of the mouth. The mechanism behind Koilonychia and glossitis relates to iron being a required cofactor for enzymes involved in rapidly dividing epithelial tissues, like the nails, tongue mucosa, and skin at the mouth corners are all high turnover tissues. Which is exactly why they're the ones affected. Pica. It is craving and eating non-food substances, like dirt, clay, chalk, and paper. Pagophagia. It is a specific subtype of pica, in which we are craving ice specifically. It is considered particularly characteristic of iron deficiency. Pagophagia, pica for ice, is particularly specific for iron deficiency, and can appear before anemia even develops, when iron stores alone are already low. Worth teaching this as a genuinely useful early clue, since a patient reporting compulsive ice chewing with normal hemoglobin should still prompt you to check ferritin. Hair loss, brittle hair. Restless leg syndrome. Dysphagia. It is difficulty swallowing, seen in the more severe chronic presentation. Impaired cognition, concentration, and attention. It is particularly relevant in children, where iron deficiency has documented effects on cognitive development. Among the features considered more specific to iron deficiency, decreased cognitive abilities, attention, and concentration are explicitly listed alongside alopecia, glossitis, and pica. And in children this cognitive effect is one of the most clinically significant long-term consequences of untreated iron deficiency, even more so than the hematologic findings alone.